Welcome to Ancora Compassionate Care's podcast, Compassionate Conversations. As a community-based, mission-focused organization, we provide hospice care, serious illness care, and counseling services. This podcast is an opportunity to explore topics that touch the heart of serious illness, caregiving, and support. Because every story, every journey, and every moment matters. Thank you for joining us. We're grateful you're here. Welcome to this edition of Compassionate Conversations. Recently, we have been having conversations about misconceptions about hospice care, myths, if you will. So what hospice care is and what hospice care is not. Today, we're going to take a deeper dive into the roles that actually make up the interdisciplinary team that is the hospice care team. One of my favorite parts about hospice care is the fact that we're actually required by Medicare to have this interdisciplinary team. And as you're going to hear today, it's something that sets hospice care apart from any other healthcare setting that you can think of. So joining me today for this conversation is Linwood Carver. He is one of our fantastic chaplains here at Ancora Compassionate Care. Kayla O'Boyle is here. She is the Director of Support Services and supervises our social workers and our chaplains here. And Hannah Clontz is also joining us. Hannah is the team leader supervising the hospice nurses that take care of patients out in the community. Thank you all so much for being here.
Thank you.
Thanks for having us.
Yeah. So this whole interdisciplinary team is one of the greatest things, I think, that Medicare says, hey, you got to have this. So it's a regulation for us, right? Mm-hmm. I would like to just kind of name the different roles that are part of this team. And then maybe we can help listeners understand what each role brings to the table. So we are required to have this interdisciplinary team has got to include a nurse. So that's an RN. Mm-hmm. We have a social worker, a chaplain, our hospice aides, which of course are certified nursing assistants, our volunteers, and we also have our bereavement support. Did I leave anybody out?
Our physician.
Our physician. I did. Well, okay, don't tell them I did that. But correct, we do have. Now, the patient can have their own physician in the community, but we certainly do have a medical director that's part of that team. Yeah. Thanks for that. So just jump in and tell us what do all of those roles mean? What's the nurse bring?
So the nurse is the case manager and coordinates the plan of care for the patient. They oversee pain and symptom management concerns, make medication adjustments for any end-of-life symptoms, and coordinate that with the physician. Mm-hmm. And they advocate for the patient's wishes and bring in the whole team together to just make sure we're all focused on the patient and their needs.
Awesome. Okay. So, and the patients have a nurse that's assigned to them, of course, what I would call the RN case manager during the week, right. But we also are required to have a nurse that is available 24 hours a day, right? Correct. So there's never any time that our patients can't get somebody on the phone or there's a visit that can be done at any time if they need. Okay, all right. So, well, I'm thinking nursing, what about hospice aides?
So our hospice aides provide the patient with personal care like bathing, dressing, shaving, changing linens, and just keeping the patient clean and comfortable and most importantly dignified during this time.
Dignified, absolutely. And you know, I'm a little biased, but I do think we have the greatest aides you would find anywhere.
Yes.
Absolutely. So okay, so that's the nursing piece. So what about emotional and spiritual support?
Well, that's my role is to bring that emotional and spiritual support. And as I tell my patients, I'm not there to evangelize. I'm there to provide support to them and to be with them. Sometimes that amounts to just being there and being present with them. And many times it's not the patient that we are addressing. We are addressing the caregiver and the family and being there for them as well. And just to provide that support with them. Many times their churches, if they had churches, are not involved. Mm-hmm. And now at this time, they still want that spiritual presence with them. And so we bring prayer, we bring singing, not my singing, but
You wouldn't want mine either, trust me.
but to bring that whole experience of a spirituality, no matter what spirituality that they have. Some people are atheists, but they still have a sense of spirit.
Right.
And so we try to be there with them in that place and that journey as they're going along. So, as I said, we're not there to bring our thoughts and what we believe, and to address their beliefs and their spiritual needs.
Well, Lynn, when you brought up a lot of fantastic things that I'm going to get back to in just a minute, but the first thing is that chaplaincy and a minister or pastor are different. And so when you say, we don't evangelize, I think it's important for the community to know that you can support any and all spiritual beliefs, the unchurched, but we also cannot separate our physical self from our spiritual self, from our mental and emotional self. So truly this interdisciplinary team is taking care of the whole person. You don't get any more holistic than this.
And I just believe people have different layers.
Correct.
And they need each layer needs to be addressed. And our role is to kind of see all the layers,
right,
but also address that deeper layer of at coming towards the end of life. They want to deal with those things that has happened in their life, have questions about their lives, and what role spirit plays into their life. And we're there to do that, but also we are ordained ministers, so we are able to take care of the rituals of the church.
Exactly.
As well as some people still like to have their communion, and some people like to have baptism. Some people like to get married.
Yeah.
And we can bring all those things to the table as well. And it pleases them that they can have a one-stop shop in regards to their spirituality.
And one of the things that I appreciate so about our chaplaincy team is you all partner with, if there is church support in place, you all partner with that person's minister. It would never be a take the place of type thing. So yeah.
And we try to bring that coordination into their lives as well. Even those denominations that we are not aware of their rituals, we are able to find people that would help us to facilitate that need as well.
Nice. Okay. All right. So what about the emotional support?
So to piggyback off of Linwood, the social workers provide psychosocial support, and we also help with advanced directives. We want to know what matters most to our patients and our families. So we are in there having goals of care conversations, how to wrap around the patient and the family as an entire team with the nurses and the chaplains. Our bereavement counselors can get involved early on with anticipatory grief needs. We can help with notarizing those healthcare power of attorneys, those living wills, be there for supportive counseling, and then we can make our referrals to the volunteer coordinator as well, who's also a part of the IDT, and have that person involved for supplemental companionship, any isolation needs that may be occurring, that sort of thing.
Volunteers are awesome.
They are very awesome.
And they are definitely part of our interdisciplinary team, but I think a lot of people would be surprised to find out that Medicare actually requires that 5% of the patient care that Ancora delivers be delivered by a volunteer. And you have to be very mission-minded for any of us to be here, right? We've got to have that heart. But you think about a volunteer. They really got to have that heart, and making sure that things are going the way that patient wants it to go, and that we can really pay attention to what matters most. They provide companionship, some respite, but golly, you think about some of the volunteers that go to a skilled nursing facility to paint fingernails. Obviously that's important to me. Me too. Things like that. But I thought, because that's part of who that person is still, right? So it kind of goes back to what's important
Yeah.
and what matters most. So, okay. I think we have touched on all of the members, but let's talk about how do these roles work together to meet the patient's needs.
So the team collaborates on a weekly basis through our IDT meetings. So we're always touching base with one another. We have real-time communication out in the field. We have communication amongst disciplines via messaging, email. I mean, we just are always in communication with one another.
And that's important. Yeah.
And then one thing I try to do is always reading the notes of each discipline to see if there's something that I can glean from what that patient and the family may need. If they're going through a crisis at this time, even if they may have declined chaplaincy, I want to follow up and say, do you need me now? Can I help support you right now in this moment?
Right.
And I talk with the case managers and finding out, who are you seeing today? Is there any particular need that they may have that I could help in? And so we just do like Kayla said, we try to stay in contact with each other and find out if there's a need in this moment, because the needs are always changing. It can change from day to day.
Yeah.
And we can jump in and supply that to be there to support them. I've had numerous patients that said, you call right on time.
Yeah.
They didn't know that I was calling because one of the case managers said, can you call them?
Gotcha.
But we want to be on time. I think it's when we look back over some of the business models that they want to be on time management. So we want to be on time as well.
Yeah, absolutely. It's so lots of communication, because when you think about how we take care of people out in the community, everybody's visiting at a different time, right? So we certainly don't all show up as a group.
Right.
So
not all the time.
Not all the time.
Sometimes we do.
Well, we do. So that's important. That was where I was going. So, but talk about that just a little bit. What would be the benefit of a nurse and a social worker going together, or a nurse and a chaplain going together to make a visit?
I think on the nursing end, our nurses can come in and work on managing the patient's symptoms, whatever the crisis may be at that moment for the patient, working on calling the physician and getting things under control for them. But the social worker and chaplain can communicate with the family member and help with the emotional distress they may be experiencing from their loved one feeling pain or whatever might be going on at that time.
I've found that many times they really appreciate the team being there, getting to know the team and know that we are a team. Because I often tell them, I say, well, you have a team working for you. And just each person and their role on the team. And the caregivers are really appreciated, especially in facilities. They can appreciate more of a team visiting as opposed to different disciplines visiting, because the patient sometimes mentally are not there. So you're able to really be there and support the team. But also, let's not forget, sometimes our case managers need to feel supported as well.
Absolutely.
And so it gives them opportunity, it gives us opportunity to support them as well while we're visiting with the patients and the families.
That's a good point.
Yeah.
So, what about social work and nursing going together?
Yeah, so the first thing that comes to my mind is a situation where, God forbid, someone has to go to the hospital. Let's just say a patient has fallen and they break something and they're in the hospital. That would be a great joint visit for a social worker and a chaplain. A social worker and a nurse, because the doctors and the nurses at the hospital are going to be talking about treatment plans and options that may be confusing and overwhelming, that the nurse can help break down what this is going to look like if we do option A versus option B, the medications, the treatment, the planning that goes into that. And then the social worker can come in and also talk about the caregiver burden that may be associated to that, the resource planning or coordination that's associated with that. So there's lots of opportunities for us to work together and tackle different questions coming in at the same time.
So that's a great segue into you know, when we are in somebody's private home, first of all, we are invited guests, and it's always extremely humbling to me that we are allowed in probably what is going to be the most vulnerable time this family is going to have. So we're always grateful for the opportunity to serve in that way. But we talked about the holistic care of the patient, but it's actually the holistic care of the whole group, right? So you so much care and support for the family. So let's just put the patients to the side for a minute. How does this interdisciplinary team care for and support family members, whether they are the primary caregiver or
Yeah.
children of the patient, whatever they may be?
Well, there's lots of ways. The first one that comes to my mind is teaching. We can all teach our caregivers and our families something, whether it's how to administer medications, how to just give yourself space to say a prayer, or give yourself time to step away and take time for yourself. The social workers can help with the advanced care planning, the resource coordination, that piece of things, the psychosocial support, coping mechanism, coping skills. So there's all sorts of teaching that can go on first. And permission to allow yourself to just pause and accept the help, accept the team, because we want to make sure that the patient and the family experiences a seamless coordination of care from start to finish.
That's beautiful. Awesome.
You know, I think also many of our patients and families, we probably 50% support the caregiver as opposed to the patient, because many of the patients are unresponsive, and the caregiver is struggling. One of the things I try to do on that first initial call is to acknowledge the challenges that the caregiver has.
Yeah.
And they seem to appreciate that we acknowledge that it's tough. It's not easy being a caregiver, because many times the focus has been on the patient.
Sure.
And sometimes the caregiver feels left out, that nobody understands. And so we try to address that concern of that you need support too. You can't pour from an empty cup.
Right.
You need to be filled as well. You need to be acknowledged as well. And to give them support, sit with them, hear their concerns, and to provide thoughtful ways. I was just talking with a caregiver a little while ago, and talked with her about she has lost family members, and now she's caring for her mother. About the importance of the ministry of memories, of how memories minister to us. And she seemed to find some peace in that as she was dealing with it, talking about her dad and losing her dad. She was just going through that. And we just talked about the importance of that ministry that memories have, of talking through it. And sometimes just being there to provide that. I didn't have to quote Bible verses or anything like that, but just talk about the ministry that remembering has to get you through the day.
And so back to one of our original points when this episode started, right, is that this interdisciplinary team is what sets us apart. Because when you think about if you've been in a healthcare setting, if you've been in a hospital, the focus is all on the patient, as it should be. I'm not. That's not me finding fault. But what a beautiful thing to have this whole team of people that can do both, patient and the caregiver, because they do have some unique needs. So thinking about nursing, and you automatically think, well, this is all about the patient. But there's so much that goes on for especially the primary caregiver too, and thinking about Kayla's point of teaching. But I heard something, we were at a summit last week, and let me see if I can get it right. We were listening to a physician speak, and he said, talking about families, being informed is not the same as being prepared. Talk a little bit about how you feel like nurses help prepare families.
I think we look more than just the disease process and just educating on, oh, this might be what you expect here, but looking at, talking about, side effects of medications and education on, this is how they may be feeling during this time. This is what they may be experiencing. This is what you're going to see as they come closer to end of life, what symptoms they may experience. And these are what the medications we can use to manage those symptoms. I think also our aides do a wonderful job coming in and lightening the load for the caregivers as well. They do a lot of that hands-on care of bathing and dressing and making sure they're, like I said before, dignified. And I think that takes such a huge load off the caregiver as well.
I do too.
I'd like to add how the nurses help the chaplains.
Okay.
To be able to understand what the patient may be feeling helps us as well. As we minister to the family members, we have a sense of if this patient is the disease process of the pain that they may have. That's one of the things I look for in the admission notes of what the disease is and try to find out how it affects the patient. And now I can sit with the patient as well as with the family member and understanding at what point that I can provide some support with that as well. So they help us as well as we are administering and providing support.
Yeah. So back to that communication and that whole coordination piece. And every single team member, no matter what our role is, we know what our primary role is, but it does, we have to be well versed in what the end of life is going to look like for so many different diagnoses, right?
That's right.
And there is informing, there's that education, but there is that support of the family that I think is that preparing part.
Right.
It's just an interesting thought that it is not the same. Right. And these folks are sleep deprived. I mean, a caregiver's job is the hardest job anybody will ever have. So, and it's 24/7. So we know that education and that support that we give is just not, it's just not a one-shot thing, right? It's going to have to be over and over, and that's okay because to Linwood's point earlier, it changes from day to day. Sometimes we know it might change from hour to hour, which means the caregiver and the family are going to be in a different place too. So lots of flexibility within our team.
Yes.
Right?
I think that's what makes hospice unique and kind of set apart from other healthcare fields is we really look at where a patient and family are and we meet them where they are.
Yes.
There is not, to an extent, like a deadline or a course that we have to follow.
Right.
Every single thing that each one of us does can be individualized, should be individualized, and should be changing each and every visit.
Agreed. And our team being able to leverage our differences is really what makes hospice care just beautiful, because we all come from different educational backgrounds, different experiences. We all have a different role, but the collaboration that you all are describing, you're not going to get any better care if you were the patient and the family. You're not going to find it anywhere else. And how beautiful is it that we can bring all of this to you in your own space?
Yeah.
That's right. That's right.
Yeah. So can you think of a time, I'm kind of putting you on the spot, but a time where this whole team came together maybe in just a very powerful way? What was a unique situation that all of this interdisciplinary team, this collaboration, really shined?
I have to say, we had a crisis with a facility, and all of us had to gather and make some calls together and talk with caregivers. And it was really helpful that everybody was there that would be able to address a concern for the caregivers. Okay. And I thought it was very impactful of how we gathered together and sat with it had the aide there, we had the nurse there, we had the social worker there, you had the chaplain there. And not only did it help the patients and the caregiver, but I think it helped us.
I'm sure.
And how we were able to feel like a unit. So that's one particular thing for me that I found very impactful as a team of how we gathered together. And the outcome was not what we may have wanted, but the patients and the caregivers was taken care of.
Yeah.
And I think we were too.
Yeah. Good support, even when delivering some unfavorable news.
Exactly.
Right. Yeah.
And many times, Lynn, that's where our greatest feeling of accomplishment comes.
Right.
Is when sometimes it doesn't work out the way you want it to.
Right.
I might preach that one day.
I think you should.
But yet it accomplished something very powerful.
Well, we've got things in place internally in our organization because we do have challenges. We do have unique situations. You know, as long as we're taking care of 130 different people and families, we're going to have 130 different situations, right? But I think it's important for the community we serve to know how well we do support one another and how well we do collaborate, because that tells them you're going to get the best and the highest quality care possible.
That's what makes us 5 stars.
It absolutely does. It absolutely does. So as we wrap up, what is one thing that you all would like listeners to know if they were to choose hospice care? What's one thing about the team you would want them to know?
I would say that we truly want to know what matters most to you and to your loved one, and we want to follow suit with that, and that be our primary focus in caring for you through the whole journey.
So what's important to them dictates what needs to be important to us.
Absolutely.
Okay.
I would say from my perspective is that I would want them to know in what may seem like the most difficult time in your life's journey that you're not alone, that you have a team working with you to fulfill and to accomplish all the goals that you have set for the life journey, because I see you still have life. It's not the end. It's just a part of life, and you still have a team here working with you in this space of life.
Okay. All right. Well, I really do appreciate it. This was a nice time to highlight what sets us apart. And I'm just grateful. You know, we've got a fantastic interdisciplinary team, and we've got the best of the best. So you got to have 5-star people to have a 5-star organization.
Well, let me add before you sign off, Lynn, we can't forget those that work behind the scenes. Our credit department, our administration, those that don't leave the office. They play a very important role for us as we're visiting patients. And if without them, we can't do what we do.
That's right.
So I want to acknowledge them as well as being a part of the team, because they are also here to make sure that the families and the patients are well taken care of. So I don't want to sign off without acknowledging them.
And I'm glad you did, because you're exactly right. You know, we say internally all the time, this is not an individual sport. It does take the entire team from top to bottom to make this go, for sure. Thank you for joining us for this episode today. I hope you learned a little bit more about what makes up our interdisciplinary team here at Ancora Compassionate Care. If you would like any more information or would like hospice care for someone that you love, please give us a call at 336-427-9022.